Thanks for having me. I hope everyone is healthy and safe. This has been a difficult time for our country and certainly our community and even Northern Regional Hospital, as many of you have experienced some difficult times for our people. So this happens to be National Hospital Week. So we've done some celebration, but for the most part, because we can't social gather even in the hospital, we've elected to defer National Hospital Week here at Northern for a date in the future where we can really celebrate as a team. I will say, for those of you on the line, don't miss a meeting, because if you do, you'll become the mixer speaker at the next function. So be aware. I assume that's how I got recruited. I want to first thank you and thank the community for welcoming my wife and I to Mount Airy and to Surrey County. We've been here almost 2 years. I retired from a CEO job that I had for 30 years in Southern Virginia, expecting to do some other things, but 4 months later, after retirement, at the age of 60, I was asked to visit Northern and to Surrey County, and I grew up in Roanoke. I did, and 4 weeks later, I'd accepted the job to become CEO here at Northern Regional Hospital. This is really an outstanding asset and resource for this community. I know you know that, but sometimes people don't appreciate the role that a hospital plays, not only in delivering health care, in our case to over 100,000 patients per year, but also really serving as an economic engine for the community as well. Having been involved in economic development, as many of you are, I recognize that industries that are considering expansion in a community or relocating to a community look at healthcare as perhaps the top 3, certainly the top 5 indicators of whether to make that decision. So the role that we play here in this community is very important from an economic development perspective as well. I also want to thank Randy and his team, Travis and Christy and Mallory and Renee and the board and you as chamber members for really hanging in there over the last few months. Randy, you've done a nice job. Thank you very much for your leadership.
Thank you.
2 quick notes. I know I only have 10 or 15 minutes to speak. But on my first visit to Mount Airy, I hate to say it, I'd never been to the city until I made my first visit, even though I grew up and spent most of my career not too far from here. But I stopped by the chamber office, Randy, and it really had a nice welcome and greeting from your folks, which was a good first impression for my wife and I to Mount Airy. And then secondly, when we did move here, we had the experience of moving downtown to go to Autumn Leaves Festival. I wasn't active in the chamber. I'd been here a few months, and I couldn't believe how impressive that event, along with all the other events that the chamber and other organizations put on in this community, was. We invited some friends from South Boston and from Roanoke to join us for that first time event, and Travis and team, it is really a wonderful asset for this community. Whenever you can draw 75,000 people to Mayberry Days and then another 200,000 people 2 weeks later to a city over a weekend is really an impressive event for a community. Most communities would die to have such an event. So that was very impressive to me, and that was long before I became active in the local chamber here. I also mentioned that soon after I arrived, somehow, I guess it was part of the hazing process, I was asked to serve as the keynote speaker at the 2019 January annual meeting of the chamber, which I enjoyed doing. It was a lot of fun, and as I told or explained to John Phillips, the chair at that time, and Randy, I tend to be very active in the community. I think it's important that a hospital be active and that we tell our story. So over the last almost 2 years, I have attempted to become more engaged as a hospital in the community in a variety of different ways, whether it be the chamber, economic development, higher education, or a variety of other community and civic activities. And I think you'll see our exposure even more so in the future. When I spoke at the annual meeting, I told a few war stories. When you're 62 and you've been doing this for 35 plus years, you do have a few stories to tell. But I really focused on what I call the 3 Ps: purpose, people, and passion. And to some degree, over the next 5 or 10 minutes, I'll touch on that theme as it relates to Northern Regional Hospital in this community. Just as a reminder, from a people perspective, Randy touched on this. We employ almost 1,000 caregivers here within our organization. Many people know that. Many people do not know that we're a very large employer in this community. We have a medical staff of about 100 physicians. We offer acute care services, outpatient services. We have a skilled unit, which is really, really superb in the hospital. It's a 33-bed unit. We also have a number of medical office buildings located on and off campus here in Mount Airy, as well as one practice in Elkin, North Carolina, as well. As some of you might know, not bragging, but I'm bragging for our people, we have been named a top 100 community hospital for the last 4 years. And just recently, within the last 3 months, we were also named by the Centers for Medicare and Medicaid as a 5-star hospital. 5 stars, the highest ranking that you can receive. 1 is the lowest. We've been a 4, but it was nice to get to the 5% or 5-star category, which represents about 9% of hospitals across the United States. So I think that just shows that we have a really dedicated, committed group of caregivers, ranging from physicians to housekeepers to dietary and clinical personnel. So a real tribute to the people that make up the fabric and heart and culture of Northern Regional Hospital. In terms of projects that we're involved in right now, and we have what we call SMART goals. So we have 20 SMART goals in 20, so we call it 20 for 20. And they're fairly robust, ambitious goals that we break into 5 categories. Those categories: 1, patient care and patient safety. 2 is employee relations. 3 would be finance. 4 would be our employee engagement, and 5 is community involvement. So our 20 goals fit into those 5 pillars of success. I'll just touch on 5 or 6 quick projects very quickly. 1, we just purchased and now is in operation a new MRI unit, and seems insignificant, but that's a $2 million capital expenditure. It's very important in the imaging or radiology department. So it's a new addition to our technology we have at Northern. Secondly, we've completely revamped our physician recruitment program. All employees are important. Our medical staff is critical to our hospital. And we now have what I consider a world-class recruitment program. And frankly, recruiting to Surry County and to Mount Airy, Randy, is not that awfully difficult. There are physicians now, both men and women, and APCs, that are looking for rural communities. They're looking for really high-class rural communities, and I consider Mount Airy and Surry County as one of those communities. So selling our community is not that difficult. So physician recruitment. 3 is, of course, most of you know that we've kind of rebranded our organization, changed our name slightly to Northern Regional Hospital, since we not only serve Mount Airy, but we serve Surry County, other counties here in North Carolina, as well as Southern Virginia. The Carroll County, Patrick County areas are very, very important to Northern Regional Hospital. So rebranding was really a focus on telling our story a little differently and making sure people know that we're a regional hospital rather than just a local community hospital. Also, we have a focus on investing in our people. I don't think we've done quite as good a job as we should have in the past. So we are really investing a lot of money in sending people back to school and really growing our own employees. That's been, I think, well received by the school system, as well as Surrey Community College, even Whitfield Community College in Virginia. So we're making substantial investments in our people that we hope pay off 2-3 years down the road. And then the last two I'll touch on of those 20 is one is remaining a top 10% hospital with our quality and patient safety rankings, which we're proud of. And then last, one that almost every engagement that I have the opportunity to speak at, folks will ask me about urgent care services, urgent care. So we are in the process of finalizing plans for an urgent care center, and we will be opening that center. We are targeting October 1 of this year here in Mount Airy. It's going to be in a very conspicuous, high visibility location. So that's something we're very pleased and proud to offer to our community. Now, perhaps a question that's really on your mind, and one that I think we're all kind of tired of hearing, and that is COVID-19 and its impact on the hospital and on the community. But let me speak to the hospital first. We unfolded what we consider a very, very aggressive intervention or COVID preparedness plan in early March. I'm not going to go through all the steps, but it was a very, very detailed plan that involved our medical staff, our employees, our leadership team, and some members from the community. The good news is that we were a leader in unfolding, our strategy to protect our people and to protect our resources. The downside of that is that it really has impacted our volumes and our revenues. Whenever you curtail outpatient surgery, which represents 80% of our surgical cases at this hospital and at most hospitals, it's going to have substantial impact on service volumes and revenue. But we did it because it was important that 2 months ago, that we ensured that our people were safe and that we had the resources, equipment, and supplies to take care of a surge should it occur